Hi group, let's talk about Unit 13, which is the sporozoea, subclass Coccidia. Here we go. So today in Unit 13, we're going to talk about the sporozoea. The subclass is Coccidia. These are the non-motile protozoans where sexual and asexual phases are in the same host. We want to first start out with a couple of terms. The first term I want to use today is called schizogony, which has to do with asexual multiplication or intracellular nuclear divisions that happen in the same stage of the life cycle. Mammals and birds are often the hosts in schizogony. In sporogeny, this is sexual reproduction that happens in the stage whereby the production of spores is seen when reproduction by fission of a spore results in sporozoites. You see this in cases of toxoplasmosis, isospora, and cryptosporidium. Definitive host is an animal host where the parasite becomes an adult. Sexual reproduction or sporogeny occurs in the definitive host. Okay, now as you're going through this lecture material, make sure that you know the infective stages in the definitive host for all of the coccidians that we're going to talk about today. So here what I've done is kind of given you a general life cycle of all coccidians, okay? The definitive host ingests oocysts from fecally contaminated source. This is the infective stage, okay? The infective sporozoites are released from the oocysts, and this is called excistation, okay? Sporozoites undergo merogony, and this is a form of schizogony that happens in Coccidia. This is again asexual multiplication. Gametes are formed, and then they go through gametogony, the meeting of a male and a female gametes to form an oocyst. Macrogametes are actually the female form, and microgametes are the male gamete form. The oocyst is formed, the cell wall is formed, and it is passed in feces, and it is now infectious at this time. Sporozoites develop inside the oocyst as it matures when it is ingested by another host. So let's take a look at cryptosporidium in the next slide. Cryptosporidium parvum is the first sporozoea that I want to talk about, and this is an intracellular pathogen found in the small intestine. It is especially problematic for people that are immunosuppressed. The coccidia is where sporogeny and schizogony occur in the same host. As you can see on the image on the left, they are acid-fast bacillus, and they're very small at about 4 to 6 microns. They have a dark red center because of the acid-fast stain, and they look less granular and bubbly than cyclospora. This is very difficult for even people that are experienced techs to make sure you can tell the difference between a cryptosporidium and a cyclospora. But cryptosporidium are much smaller than cyclospora at about 4 to 6 microns. Cryptosporidium parvum causes a cholera-like diarrheal illness. Some cases can be life-threatening, especially in AIDS patients. This is a pathogen of the gastrointestinal tract of mammals, including humans. The immunocompromised are especially susceptible, and like I mentioned, it's especially true in AIDS patients. This organism damages the intestinal epithelial cells, and acute diarrhea can occur. It is mild diarrhea all the way up to very serious and cholera-like diarrhea. It is considered a self-limiting disease in normal, healthy people. This is transmitted by the infective oocysts and fecal material, and they are highly resistant to most disinfectants, okay, especially common disinfectants used in hospitals and clinical laboratories. The oocysts are highly resistant to most of those disinfectants. You can use an acid-fast type stain to view the oocysts. And here in the last slide, what you observed was the infective stage or the oocyst stage. The best way to help recognize cryptosporidium organism is by doing a modified acid-fast stain. The oocysts are modified acid-fast positive, and you can actually do that stain after you've already done the concentration using either flotation or sedimentation methods. The oocysts are not going to take up the iodine in wet preps. Now we want to compare cryptosporidium to yeast. Yeast are not acid-fast positive, and they will stain with iodine on wet mounts. Okay, like I said, the oocysts can be seen on sedimentation, but they are often confused with yeast, and so the best way to identify them is to do the acid-fast stain. Or we can do a fluorescent method such as a direct fluorescent antibody test for the amplification of Cryptosporidium. Now, in these outbreaks of Cryptosporidium have occurred in daycare centers, hospitals, and they are associated with things like non-pasteurized apple cider, green onions, and even chicken salad. In 1993 in Milwaukee, there was an outbreak of Cryptosporidium. The city water was contaminated, and there were 403,000 people that ended up ill because of the bad filtration system. This cost the city about $96 million, and 400 people were severely affected. Of those 400 people, several people did die, and those were people that were already immunosuppressed, such as AIDS patients. So here's a nice picture of an acid-fast stain on the left, and you can see that all those red dots are acid-fast organisms, which are the Cryptosporidium oocysts. They're about 5 microns long. On the right-hand side, what we have is the oocyst released from a sporozoite, and that would be Cryptosporidium on the right as well. Isospora belli is the next organism I want to talk about. It's not nearly as commonly seen as Cryptosporidium, but it may be found in the small intestine. The life cycle is very similar to Cryptosporidium, but it's not fully understood by scientists. The oocyst was divided to form 2 sporoblasts, and each sporoblast contains 4 sporozoites, and it's the sporozoites that are in the infective stage. This disease is transmitted by contaminated food and water or environmental surfaces. You can see on the right-hand side that we have an Isospora belli that has 2 sporoblasts, or 1 sporoblast dividing into 2, and usually it's the sporoblast that stains positive with the acid-fast stain. Each sporoblast contains 4 infective sporozoites, and you can see that the whole Isospora belli is very elliptical in size and is about 30 by 12 microns. Some symptoms and treatment for Isospora belli. They have typical symptoms of a coccidia, which would include diarrhea, acute fever, and abdominal pain. And then they also have another symptom called steatorrhea, which is basically the presence of excess fats in the feces. That can also be seen in Giardia infections as well. It is a self-limiting disease, but it may actually hang on with the patient for months. To help with the diagnosis of Isospora belli, we want to find the oocysts in fecal samples. Humans are the only known definitive host, and we harbor the sexual reproduction stage. There is no known intermediate host. We also want to look for Charcot-Leyden crystals, which are highly associated with Isospora belli. We want to examine intestinal biopsies of the small intestine. We can do flotation procedures, which may be helpful in finding this ova, or we can also use modified acid-fast stains because it is modified acid-fast positive. Those sporoblasts are going to be positive and will turn red because of the acid-fast stain. Here's a nice picture of Isospora with the acid-fast stain, and what we can see happening here is sporoblasts that stain positive with the acid-fast stain. You can see that the elliptical outer edge of the coccidian is very clear and transparent. I want to talk now about Cyclospora cayetanensis, which is another coccidia that can cause tummy troubles. It resides in the small intestine, and the life cycle is not completely understood. It is slow to sporulate and can become infectious. If you look in the picture on the right, you can see that it is more wrinkled or more wrinkly looking than Cryptosporidium, but it is in fact quite similar. It is similar to Cryptosporidium, but they're larger than Cryptosporidium. Cyclospora are actually about 8 to 10 microns. It's always very, very important when we come across an acid-fast organism like this that we measure it. Okay? The infected stage are the sporozoites released from the sporoblasts, and they are acid-fast positive. They are larger and lighter pink and more granulated and bubbly than Cryptosporidium. There have been several cyclospora outbreaks in recent history. In 2005, there was a Florida restaurant chain that was contaminated with cyclospora in their basil. In 2006 in Brazil, their water was contaminated with cyclospora, and in 2010 there was a place in Canada where they were serving hors d'oeuvres at a public event and they all became contaminated with cyclospora as well. The transmission of cyclospora is contaminated water. There was a Chicago outbreak when the city water was contaminated with cyclospora because of the rooftop water reservoirs. It's also associated with bad strawberries and raspberries. Toxoplasma gondii is an intracellular parasite. It is associated with cat feces. Humans acquire by ingesting something contaminated with cat feces, and this organism causes toxoplasmosis. Most people don't even know that they've ever had it, but it can be very dangerous to AIDS patients and babies. In fact, babies can be born with blindness or mental retardation or hydroencephalus. Okay? The cat in this particular circumstance is the definitive host, and the parasite is an intestinal parasite of the cats. So usually indoor cats are unlikely to get toxoplasmosis. Immunosuppressed people can't produce antibodies to toxoplasmosis, and this is diagnosed serologically either by direct fluorescent antibody or complement fixation, or by tissue biopsy, and it can be transferred from mom to baby. What you can see on the right are the oocysts and the tachyzoids. The parasites actually divide in the tissues as tachyzoids, and it's the tachyzoids that are passed to the fetus. Okay? Pneumocystis jirovecii, formerly carinii, but jirovecii is the human variant of Pneumocystis carinii. Pneumocystis, there has been some debate that it is either a protozoan or a fungi, and now they are calling it a fungus. The old thought was that it was a protozoan. This particular organism causes pulmonary infections, especially in AIDS patients. You've probably heard of pneumocystis pneumonia. It is rare in people that don't have HIV. This appears as a cyst-like form, and they are about 5 to 12 microns with 8 nuclei that form inside of a rosette. The diagnosis of Pneumocystis jirovecii is by using special stains or serological testing. Over on the right, we can see a GMS stain where pneumocystis is black and it's very delicate looking with an internal black comma. That's very typical for pneumocystis and how it was stained in a GMS stain. And then finally, with the last stain here, I want to talk a little bit more about the GMS stain, and that stands for Gamori Groschet methenamine silver stain. This is actually a fungus stain where fungal elements look black on a green background. Now, pneumocystis, we're calling it a fungal element. It used to be called a parasite, but now we are calling it a fungal element. It has distinct black edges with a black dot in the middle. Go ahead and go back to the previous slide to see what pneumocystis looks like. The reagents that we use in the staining of a slide for pneumocystis or for fungus is we're going to use reagents such as methenamine, silver nitrate, sodium metabisulfate, and light green solution. And what you can see are black fungal elements on a green background. That's it for Unit 13, where we talked about the non-motile protozoans where their sexual and asexual phases are in the same host, and that would include the sporozoea subclass Coccidia.